Good morning. My name is Charles Sine. I'm the CEO of the Anti-Fragility Health Clinic here in the US and in Vietnam. Welcome. Today we want to talk about a few tips that we're advising all our patients with regard to the coronavirus. We have two groups of patients. We have patients who are vulnerable based on age and chronic illnesses, and we have patients who are young and healthy, but we are also providing guidance for both. We've distributed our guidance into two areas, what we call outside health, and the outside health focus is really about habits, on how you can reduce your bacterial load, and so we focus on overall health for the overall body, but specifically hand washing, specifically mouth, how often you reduce that bacterial load, eyes and face, because the hands tend to touch those areas. So we've provided guidance around that, how often you do that, and how you clean and keep that overall external load, including how you take your clothes that you are using outside, whether you take them inside house, you wash your hair, shoes, all outside. So you're leaving everything that you are contacting with outside the house, you leave them outside before you enter the house. So our houses become like the private spaces that are really very safe with regard to if you live with family or friends. So you reduce the amount of the bacterial load inside the house. We also then focus inside the body. For people who are vulnerable, we want to address the underlying issues that aggravates the infection, which are around the speed of the infection, the inflammation, and the underlying issues, and we have products around that to support that. And for healthy people, we just want to make sure that the minerals and vitamins that are critical for supporting the immune system, that they take those diligently and practice the lifestyle habits that we've been teaching in the clinic around 5 key areas. Number 1, sleep. It is very important that you sleep 8 hours. And if sleep is challenging, we have melatonin and other aids to support that. Melatonin has other really great effects. Number 2 is exercise. We know it's challenging to go out to exercise, so there are lots of programs on TV. You can have your yoga mat, but do some level of exercise, yoga, stretching every day. It's very important. Number 3 is the diet, no sugar, and very, very light carbohydrates. For some of our vulnerable patients, we've also pushed them towards some diet restrictions. We've also reduced the amount of calorie intake, and we've also reduced them to at least 1 or 2 meals a day. The third and fourth area is around stress, really managing your stress in the 4 areas of stress, which include sleep, inflammation, glycemic dysregulation, and perceived stress. So all those areas we're providing significant guidance. And lastly, but not least, hydration, drinking good, clean water, so that the biological systems of the body continue to function optimally. We think that following these guidelines provide both our vulnerable and non-vulnerable patients the opportunity to survive the crisis. Thank you for joining us this morning.